Hello guys, I'm Deepak Shukla. Welcome to our channel Study Mania. I'm starting a series on psychiatry where I'll make videos on frequently asked questions in university exams. Let's learn about depression. Depression is a mood disorder or also known as affective disorder. Okay? So depression is a mood or affective disorder characterized by persistent low mood, reduced energy and loss of interest or pleasure, and impaired functioning lasting for at least 2 weeks. Okay, so duration is 2 weeks, and that is sufficient to impair the social and occupational functioning. So this is definition about depression that we'll write in the university exam. Now coming to core features, we have to remember by EMI. Okay, so learn by the mnemonic that a person has taken EMI and he cannot repay that and he is in depression. Okay, so what is EMI? EMI is decreased energy, decreased mood and decreased interest. Okay, so this is the core feature and you have to write this for sure in depression. And along with EMI, what other clinical features you have to write is emotional or affection features. Okay, that is persistent low mood, anhedonia. What is anhedonia? Anhedonia means that this loss of pleasure from previously pleasurable activities. Means earlier he was having some pleasure in doing that work but now he's not having that pleasure. So under emotional symptoms we have persistent low mood, anhedonia, hopelessness, very important, hopelessness, helplessness and suicidal ideas. Suicidal ideas is very important. Okay, so these are the symptoms, emotional symptoms in depression. Then what are the cognitive symptoms that you'll see? There will be poor memory and poor concentration. Okay, so this poor memory and poor concentration is very important. Then negative thought and guilt. Okay, guilt is very important here. Then worthlessness will be there. Then pessimistic view of the future and delusion of poverty and guilt will be there in cognitive symptoms. Coming to biological symptoms, that is also very important, also known as somatic symptoms. There is reduced energy, that I have told you, reduced, okay, more of fatigue. Then early morning awakening, very important, early morning awakening and terminal insomnia, loss of taste, weight loss, and psychomotor retardation or agitation. So these are very important clinical features in depression. And if two core symptoms are present and along with that almost 3 to 4 these symptoms are present, we'll diagnose it as depression, but the symptoms should last for at least 2 weeks. Okay, so this is about depression definition, what you'll write, and what are the clinical features. Okay, coming to etiology, we have genetic factors, then we have neurochemical imbalance. Okay, then we have psychosocial stressors, sleep deprivation and substance abuse. Okay, so same thing, whatever you know you can write. Now coming to important thing that you have to remember. Okay, classification according to ICD-10. So the first thing is depressive episode is mild, moderate and severe. Okay, so depending upon the depressive episode, it is mild, moderate and severe. Okay, in severe it is congruent with the psychotic symptoms. Okay, and there will be more prominent symptoms of depression. Okay, so the first thing is depressive episode, mild, moderate and severe. Then we have recurrent depressive disorders, then we have persistent mood disorders. In persistent mood disorders we have dysthymia. What does it mean? What do you mean by dysthymia? There is chronic low mood for almost 2 years. Okay, so chronic low mood for almost 2 years. Okay, example in cancer patients with long term medications. So first thing is dysthymia. Second is double depression. Double depression means what? The person was already having dysthymia, now on top of that he is now having depression. Okay, so till 2 years he was having dysthymia, now he also having depression. Okay, this is double depression. Then we have cyclothymia. Cyclothymia means what? There is cyclical low and high moods for more than or equal to 2 years. Okay, low and high mood, cyclic for almost 2 years. Then we have chronic major depression. Chronic major depression means major depressive disorders for more than 2 years. So this is about persistent mood disorders. Then we have seasonal affective disorders, then we have premenstrual dysphoric disorders, and then we have postpartum depression and atypical depression. So these are the classification of depression. Okay, Depressive episodes, recurrent, persistent mood disorders, dysthymia, double depression, cyclothymia, chronic major depression, seasonal affective disorders, premenstrual dysphoric disorders, postpartum depression, depression and atypical depression. So these are the classes. We have already seen about the clinical features. Okay. What are the objective signs we'll see? First thing is omega sign, and then we have Veragut sign. What is omega sign? Omega sign is omega shaped fold at root of the nose. Okay. Omega shaped folds at the root of the nose. Okay. What is Veragut sign? It is a diagonal or triangular folds in upper eyelid. Okay. Diagonal or triangular folds in the upper eyelid. Okay. So this is two objective signs you'll see in person with depression. Coming to etiopathogenesis that I've tried before only. So here we have neurotransmitter derangement. Okay, neurotransmitter derangement means what happens? This whatever excitatory hormones was there, that is reduced. Okay, so there is reduction in 5-HT, that is serotonin, reduction in norepinephrine, reduction or reduced dopamine, reduced BDNF, and reduced 5-HIAA. What is BDNF? Brain development neurotropic factor. What is HIAA? Is 5-hydroxy indole acetic acid. So there is reduced neurotransmitters, also known as neurotransmitter derangement. Then we have cognitive errors. What is cognitive errors? Beck's. You have to write Beck's cognitive triad of depression in this: hopelessness, helplessness, and worthlessness. Okay. So in cognitive errors, you can write this. Then conflicts. In conflicts, you have to write about grief, means mostly due to ambivalence, he cannot take decision. Anger turned inwards, and introjection. What is introjection? Introjection is taking responsibility for events that is out of their control. Okay, so that is introjections. So this is about the etiopathogenesis of depression. Coming to management, very simple. First we'll write pharmacotherapy, second side we'll write psychological therapy. In pharmacotherapy, we'll write antidepressants, SSRI, TCA, SNRI, and that to be continued for almost 6 to 12 months after recovery. Okay, so just name some SSRI, SNRI, and TCA. Then write about psychotherapy. In psychotherapy, everywhere you can write this CBT, that is cognitive behavioral therapy. Okay, then interpersonal therapy and supportive psychotherapy. So all these fancy names you can write. Keep in mind, this is just for writing university exams. Okay, we are not going to do PhD in depression right now. Then write electroconvulsive therapy, that is indicated only in severe depression with suicidal thoughts. Okay, electroconvulsive therapy indicated only in severe depression and depression with psychotic features and drug resistant depression. We can go for electroconvulsive therapy. Okay, so just write this down side, you'll fill the pages. Okay, so this was about depression. You can write for 5 marks. Okay, thank you so much.